More than half of surgical procedures performed each year involve adults over the age of 65, and while most operations themselves are technically successful, older adults account for a disproportionately high percentage of post-surgical complications and hospital readmissions. In many cases, the surgery goes well, but the recovery quietly unravels after discharge. Here's what most people don't realize. Complications rarely begin in the operating room. They begin at home. Infections, delayed wound healing, blood clots, weakness, and unexpected setbacks often develop days or even weeks after the procedure. And for adults over 60, healing physiology is different. Immune response slows, circulation may be less efficient, and muscle mass declines more quickly with inactivity. That means recovery requires more than just time. If you want clear, practical health guidance like this, consider subscribing and hitting like. The goal here isn't fear, it's preparation. Because surgery is not the finish line, it's the starting point of a critical healing window. And what you do in the first days and weeks after discharge often determines how smoothly or how slowly that healing unfolds. So the real question is not simply, was the surgery successful? The deeper question is, what slows healing after surgery, especially after 60? And to answer that, we need to challenge a very common assumption about recovery, one that quietly leads many people in the wrong direction. There is a comforting belief many people carry after surgery: just rest and it will heal. Time passes, stitches dissolve, and the body takes care of the rest. For younger adults with strong immune systems and resilient tissue, healing often follows that simple narrative. After 60, however, the biology changes. Healing is not automatic. It is a coordinated biological process that depends on immune signaling, blood flow, protein synthesis, and precise inflammatory regulation. And each of those systems becomes less efficient with age. Let's start with the immune response. After surgery, your body enters the inflammatory phase. White blood cells rush to the surgical site to clear debris and prevent infection. In older adults, immune cells may respond more slowly or less aggressively. That delay can subtly increase the risk of infection or prolonged inflammation. Next comes collagen production. Collagen is the structural protein that rebuilds tissue. Fibroblast cells produce collagen during the proliferative phase of healing, but aging reduces fibroblast activity and collagen synthesis. The result? Wounds may close more slowly, and scar strength develops more gradually. Circulation also plays a critical role. New blood vessels must grow, a process called angiogenesis, to deliver oxygen and nutrients to the healing tissue. With age, vascular elasticity decreases and microcirculation becomes less robust. Reduced blood flow means slower oxygen delivery, and oxygen is essential for effective tissue repair. Then there is inflammation regulation. The body must carefully control inflammation, enough to fight infection, but not so much that it damages tissue. In older adults, inflammatory responses may linger longer than necessary, delaying progression to the next phase. Healing occurs in 3 phases: inflammation, proliferation, and remodeling. Each phase must progress in sequence. If one is prolonged or disrupted, recovery slows. What people think, rest and it will heal. What actually happens? Healing requires active biological support. And to understand how common mistakes interfere with these phases, we need to look closely at what is happening inside your body after surgery. When surgery ends, your body immediately shifts into repair mode. Healing begins within minutes, but it follows a precise biological sequence that must unfold correctly. The first phase is the inflammatory phase, typically lasting about 3 to 5 days. During this time, white blood cells, especially neutrophils and macrophages, migrate to the surgical site. Their job is to clear bacteria, remove damaged tissue, and release chemical signals that coordinate the next stage of healing. Mild redness, warmth, and swelling are normal in this phase. These are signs of immune activation, not failure. Once the area is cleaned and stabilized, the proliferative phase begins. This phase can last from day 4 through roughly 2 to 3 weeks, depending on the type of surgery and overall health. Fibroblasts, specialized connective tissue cells, begin producing collagen, the protein that gives healing tissue its structure and strength. At the same time, angiogenesis occurs. New blood vessels grow into the wound to supply oxygen and nutrients. Oxygen is not optional in this process. It is required for collagen cross-linking, immune defense, and cellular metabolism. Poor oxygen delivery slows every step of healing. This is why circulation matters so much after surgery. If blood flow is reduced due to immobility, arterial stiffness, smoking history, or chronic vascular disease, tissue repair slows. The final phase is remodeling. Over weeks to months, collagen fibers reorganize and strengthen. Scar tissue matures. Tensile strength improves gradually, but it may never reach pre-surgery levels. Now consider how conditions like diabetes or peripheral vascular disease affect this sequence. Elevated blood glucose impairs white blood cell function and increases infection risk. It also disrupts microvascular circulation, reducing oxygen delivery to tissue. Poor circulation limits angiogenesis and nutrient supply. These factors significantly increase the risk of delayed healing. Protein intake also plays a crucial role. Collagen synthesis requires adequate amino acids. Without sufficient dietary protein, fibroblasts cannot build strong tissue. Movement, too, influences recovery. Gentle activity improves circulation and oxygen delivery. Complete immobility slows blood flow and increases clot risk. Healing is an active biological process. It depends on oxygen, protein, circulation, immune signaling, and careful progression through each phase. And this is exactly where common post-surgery mistakes begin to interfere, often without patients realizing it. Mistake number 1. Moving too little. After surgery, many older adults assume the safest strategy is strict rest. The logic seems sound. Protect the wound, avoid strain, and stay in bed as much as possible. But in many cases, excessive bed rest does more harm than good. Movement is not the enemy of healing. Immobility is. When you remain still for long periods, circulation slows. Blood flow to muscles and surgical tissues decreases, and with it, oxygen delivery declines. Oxygen is essential for collagen synthesis and immune defense. Without adequate oxygen, tissue repair slows, and the inflammatory phase may linger longer than necessary. Reduced movement also increases the risk of deep vein thrombosis, DVT. When blood pools in the legs due to inactivity, clots can form in the deep veins. These clots can become dangerous if they travel to the lungs, causing a pulmonary embolism. Adults over 60 are already at higher risk for clot formation due to age-related changes in blood viscosity and vascular tone. Add immobility to that equation, and the risk rises significantly. Beyond clot risk, prolonged bed rest leads to rapid muscle loss. After 60, muscle mass declines more quickly during inactivity. Even a few days of limited movement can reduce strength and balance, increasing fall risk once you try to resume normal activity. This is where the misunderstanding occurs. What people think: I need to protect the wound by staying still. What actually happens: appropriate guided movement improves circulation, supports oxygen delivery, and accelerates healing. Of course, this does not mean overexertion. Mobility must follow your surgeon's instructions, but gentle walking, leg exercises, and upright time are often part of the prescription, not a violation of it. Many seniors delay movement out of fear and unknowingly slow their own recovery. And while moving too little is common, the opposite mistake can be just as disruptive. Mistake number 2. Moving too much too soon. If moving too little slows healing, moving too much too soon can set it back just as easily. After surgery, tissue strength is temporarily reduced. Sutures, staples, or internal closures are holding healing layers together, while collagen production gradually rebuilds tensile strength. During the early proliferative phase, the tissue is fragile. Excessive strain can disrupt that process. Overexertion may increase inflammation at the surgical site. Swelling can intensify. Micro tears in newly forming collagen fibers may occur. In some cases, sutures can loosen, wounds may partially reopen, or internal repairs can be stressed before they are secure. This often happens with good intentions. Many patients feel slightly better after a few days and assume they are ready to resume household tasks, lifting, or prolonged walking. They push through fatigue, believing they are accelerating recovery. In reality, they may be creating internal stress on healing tissue that requires additional inflammation to repair. The key distinction is this: guided mobility supports healing. Uncontrolled overexertion disrupts it. Safe activity follows physician instructions. Surgeons often provide specific weight limits, walking goals, or restrictions on bending, twisting, or lifting. These are not arbitrary rules. They are designed to match tissue strength to activity level. Recovery after 60 requires balance. Movement should be gradual, structured, and aligned with your body's biological timeline. And while mobility mistakes are visible, another major factor in healing is less obvious: what you eat, or sometimes what you don't. Mistake number 3: poor nutrition and protein deficiency. After surgery, appetite often decreases. Pain medications can blunt hunger. Nausea may linger. Fatigue reduces the desire to prepare meals. Many older adults unintentionally eat far less than their body needs during the most critical phase of healing. This is not a minor issue. Collagen, the primary structural protein used to rebuild surgical tissue, is made from amino acids. Without adequate dietary protein, fibroblast cells cannot synthesize collagen effectively. The proliferative phase slows. Scar strength develops more gradually. Wounds may close more slowly. For many older adults, a protein intake of approximately 1.0 to 1.2 grams per kilogram of body weight per day is often recommended during recovery, unless kidney restrictions apply. That means a 70-kilogram individual may require 70 to 84 grams of protein daily. Many seniors fall well below that threshold without realizing it. Serum albumin levels, often measured in routine blood tests, can provide insight into nutritional status. Low albumin is associated with delayed wound healing and increased infection risk. Micronutrients also matter. Vitamin C plays a direct role in collagen cross-linking. Zinc supports immune function and tissue repair. Even mild deficiencies can subtly impair healing speed. Hydration is equally critical. Adequate fluid intake supports circulation, nutrient transport, and cellular metabolism. Dehydration reduces blood volume and can slow oxygen delivery to tissues. The misconception is that eating lightly is harmless after surgery. In reality, undernutrition quietly interferes with every stage of recovery. What feels like just not being hungry can delay healing by days or weeks. And beyond nutrition, medications themselves can influence recovery, especially when they are mismanaged. That brings us to another common mistake. Mistake number 4: ignoring subtle signs of infection. In the first few days after surgery, some redness, warmth, and swelling are completely normal. That is the inflammatory phase doing its job. The body is clearing debris, activating immune cells, and preparing tissue for repair. Mild tenderness is expected, but there is a difference between controlled inflammation and infection. Early signs of infection can be subtle: redness that spreads rather than stabilizes, warmth that increases instead of gradually fading, pain that intensifies instead of slowly improving, new or worsening drainage from the incision, especially if it becomes cloudy, thick, or foul-smelling. A low-grade fever may appear, sometimes only a slight elevation. In older adults, however, infection does not always present with high fever. Seniors may instead experience unexpected fatigue, weakness, or even mild confusion. Mental changes can be an early warning sign that something systemic is developing. This is where many people make a dangerous assumption. They tell themselves, it's probably normal. They wait another day, then another. The problem is that infections are far easier to treat early. A small bacterial overgrowth at the wound site can often be managed quickly with antibiotics or local care. But when warning signs are ignored, bacteria can spread deeper into tissue, leading to abscess formation, systemic infection, or hospital readmission. Older adults may not mount dramatic symptoms. The immune response may be muted. That makes early vigilance even more important. Normal inflammation gradually improves. Infection tends to escalate. If something looks or feels different from yesterday, that change matters. Reporting subtle symptoms early is not overreacting. It is protecting your recovery window. And while infections are visible, another common setback happens more quietly through medication errors. That's the next mistake many people don't see coming. Mistake number 5: mismanaging medications. After surgery, medication instructions are not optional. They are part of the healing plan. Yet this is where many setbacks begin. Skipping prescribed antibiotics or stopping them early can allow bacteria to rebound. Even if the incision looks better, incomplete antibiotic courses increase the risk of resistant infection and delayed wound recovery. Healing depends on a controlled microbial environment. On the other side, overusing pain medications can create its own problems. Excessive opioid use may suppress appetite, worsen constipation, reduce mobility, and cloud mental clarity, all of which indirectly slow recovery. Pain control is important, but it must be balanced. Stopping blood thinners improperly is another serious risk. Some patients are prescribed anticoagulants temporarily to prevent deep vein thrombosis after surgery. Discontinuing them early increases clot risk. Continuing them without guidance when bleeding risk remains high can also be dangerous. These medications directly influence clot formation and must be managed precisely. Blood sugar control is equally critical. Elevated glucose levels impair white blood cell function and slow collagen formation. Even individuals without diabetes may experience temporary glucose spikes after surgery due to stress hormones. Failing to monitor and manage blood sugar can significantly delay healing and increase infection risk. Medications influence inflammation, clotting, immune defense, and tissue repair. Small missteps can have large consequences. And sometimes, what begins as a minor oversight turns into a much larger setback. Let me share an example that illustrates how quickly this can happen. A real-world case, a small delay that became a big setback. Consider Mrs. Thompson, a 72-year-old who underwent a routine abdominal surgery. The procedure itself went smoothly. She was discharged home with instructions to walk gently, eat well, complete her antibiotics, and monitor the incision. For the first few days, everything seemed fine, but around day 5, she noticed the area around the incision looked slightly redder than before. It felt warmer, and her appetite had dropped. She assumed it was just part of normal healing. After all, surgery is uncomfortable. Over the next 2 days, the redness spread a little further. The incision became more tender. She felt more tired than expected, but told herself she just needed more rest. She finished her antibiotics early because she felt they were upsetting her stomach. By day 8, mild drainage appeared. A low-grade fever followed. When she finally contacted her doctor, the infection had already progressed deeper into the tissue. She required intravenous antibiotics and was readmitted to the hospital. The original surgery had been successful. The setback occurred during recovery. Nothing dramatic happened overnight. It was a series of small, minimized signs, redness, warmth, appetite loss, that slowly escalated. The lesson is not that complications are inevitable. It is that early action prevents escalation. A phone call on day 5 might have prevented hospitalization on day 8. Recovery after 60 requires attentiveness. Small changes matter. So how do you know whether what you're seeing is normal healing or an early warning sign? Let's walk through a simple self-check you can use every day during recovery. Recovery improves when you observe it deliberately. You don't need medical training to notice meaningful changes. You need consistency. Each day, take 1 minute to ask yourself these questions. Is the wound more red or more painful than yesterday? Healing incisions typically improve gradually. Increasing redness, spreading warmth, or rising tenderness can signal early infection. Is swelling decreasing as expected or slowly increasing? Mild swelling is normal in the first few days, but progressive swelling deserves attention. Are you eating at least 2 protein-rich meals daily? Your body needs amino acids to rebuild collagen. If appetite is low, that alone can slow tissue repair. Are you walking or moving as instructed by your surgeon? Too little movement slows circulation. Too much may strain healing tissue. Follow the plan exactly. Have you developed a new fever, unusual fatigue, or mild confusion? In older adults, infection may present subtly. Even small changes in energy or clarity can matter. Write your answers down. Keep a simple daily log for the first 2 weeks after surgery. Patterns are more important than single moments. This self-check is not about anxiety. It is about awareness. And if something in that daily review raises concern, the next step is not to guess. It is to follow a clear, structured corrective plan. If you want to protect your recovery after 60, structure matters. Healing is not passive. It responds to consistent, deliberate action. First, follow your mobility plan exactly as prescribed. If your surgeon recommends short walks 3 times per day, do that. Not less and not more. Appropriate movement improves circulation and oxygen delivery, while overexertion can strain healing tissue. Precision protects progress. Second, prioritize protein intake. Aim for at least 2 protein-rich meals daily, unless medically restricted. Lean meats, eggs, dairy, legumes, or medically recommended supplements help provide the amino acids required for collagen formation. Without adequate protein, the wound cannot rebuild strength efficiently. Third, stay hydrated. Adequate fluids support circulation, nutrient transport, and kidney function. Dehydration reduces blood volume and can slow oxygen delivery to healing tissues. Fourth, check the wound daily. Look for changes in redness, swelling, warmth, or drainage. Compare today to yesterday. Small differences matter. Early detection prevents escalation. Fifth, keep every follow-up appointment. Post-operative visits allow your surgeon to assess healing progress, adjust medications, and address concerns before they become complications. Finally, report subtle changes early. Mild increases in pain, appetite loss, low-grade fever, or mental confusion in seniors may signal early infection or delayed healing. Prompt communication prevents readmission. Recovery is a partnership between you, your surgeon, and your primary care provider. When you communicate early and follow structured guidance, complications become less likely. And once the immediate healing window closes, the focus shifts toward long-term resilience, rebuilding strength, and protecting future health. Surgery is not the end of treatment. It is the beginning of rebuilding. After the incision heals, strength restoration becomes the priority. Muscle mass declines quickly with inactivity, especially after 60. Gradual conditioning through guided physical therapy or structured walking helps restore balance, endurance, and joint stability. Monitoring blood sugar remains important, even for those without diabetes. Elevated glucose levels can impair tissue repair and increase infection risk. Stable blood sugar supports long-term recovery. Annual health optimization also matters. Review medications, cardiovascular risk factors, bone density, and fall risk regularly. Recovery is smoother when underlying health is strong. Fall prevention should remain a focus during and after recovery. Weakness, deconditioning, or lingering dizziness can increase instability. Surgery is not a finish line. It is a turning point. The goal is not just healing the wound, but rebuilding resilience and protecting independence for the years ahead. Healing after 60 is not automatic. It requires active participation. The surgery may be over, but recovery is a daily process shaped by small decisions: how you move, what you eat, how closely you monitor changes, and how quickly you report concerns. Most complications don't appear suddenly. They develop quietly when early signals are missed. Protecting your healing window means staying attentive, structured, and proactive. Recovery is not about perfection. It is about consistency. And if you value clear, practical health guidance designed for real life after 60, consider subscribing for more evidence-based support.